So this short tutorial will go through the groups of muscles that act upon the various joints of the upper limb. We'll begin with the actions at the pectoral girdle. So these muscles will ultimately move the scapula and or the clavicle. For the first action, we'll look at elevation. So this is to ultimately pull that scapula and clavicle superiorly. So in order to do that, these muscle fibers would need to be above the scapula or the clavicle. So this includes trapezius and also the muscle that has a bit of a clue in the name, levator scapulae. For depression, the opposite must be true. These muscle fibers must be below the scapula and or the clavicle. And these include trapezius and also specifically for the clavicle, subclavius. So again, these muscle fibers would be below the scapula and or the clavicle. Retraction is to pull the scapula towards the vertebrae, so to retract the shoulder towards the back, if you will. So in order to do that, these muscle fibers must be located between the scapula and the vertebrae, ultimately pulling toward the vertebrae because the vertebrae aren't going to go anywhere. So when these muscles contract, when they shorten, that scapula moves towards the vertebrae. That is retraction. So trapezius has muscle fibers here as well between scapula and vertebrae, running in a slightly horizontal, if not slightly diagonal direction towards the vertebrae. So does rhomboid major, as does rhomboid minor. Protraction is to pull the entire pectoral girdle forward, pull the scapula more anteriorly. So a muscle to help us there is serratus anterior. It's referred to as serratus anterior because it has muscle fibers between the scapula that proceed or attach anteriorly towards the ribs. And so when the serratus anterior contracts, when it shortens, that scapula can be pulled forward toward the 8 or 9 ribs anteriorly at that anterior attachment. Next, we'll take a look at the actions at the shoulder joint proper. This is the joint between the glenoid cavity or glenoid fossa and the head of the humerus. Again, the shoulder joint proper. This isn't the entire shoulder complex. This isn't moving the entire pectoral girdle, scapula, and clavicle. These muscles will act upon the humerus itself to pull it relative to this, again, shoulder joint proper. All right, to perform flexion is to pull the arm forward. So the muscles that perform flexion at the shoulder joint must cross the front or anterior of the shoulder. These include deltoid, pec major, biceps brachii is also there, and coracobrachialis. The opposite must be true. To perform extension, you must be pulling from behind. So deltoid's also behind the shoulder joint. Its muscle fibers are crossing posterior to the shoulder, as well as latissimus dorsi, pulling that humerus back towards the vertebrae. Again, it's posterior attachment. It's origin or proximal attachment. Abduction is to pull the arm away from the midline. So these muscles must attach outside of the shoulder to the lateral aspect of the shoulder. And really what that means is on the way to the lateral shoulder, they really have to cross above the center of the shoulder joint. And so deltoid does this. It's actually the primary abductor, and supraspinatus does as well. Supraspinatus is described as initiating the first 15 degrees of abduction. Adduction is to pull the arm back towards the midline. Muscles that do this would include pec major, pectoralis major, latissimus dorsi, and teres major. Recall that these 3 muscles all share an attachment to the front of the humerus, the intertubercular sulcus. But the reason that they can perform adduction is because they pass horizontally relative to the axilla or the armpit, really below the center of the joint. Some of their muscle fibers, maybe not all of them, but some of their muscle fibers are below the center of the joint. So when they pull, they would pull that arm back towards the rest of the body. If you were to put your arm in your axilla, or better said, put your hand in your axilla, and you adduct, you can feel these muscles contract. The next 2 actions that we'll look at the shoulder include medial rotation and lateral rotation, also known as internal rotation and external rotation, relatively speaking. So for medial rotation, notice the 3 muscles show up together again: pectoralis major, latissimus dorsi, teres major. Oftentimes we can use a bit of a tool here, the lieutenant or latissimus, between the 2 majors. Subscapularis and deltoid also help with medial rotation. all of the muscles in this group have muscle fibers that pull horizontally, if not diagonally, on the humerus, specifically from anterior. So in order to be a medial rotator or an internal rotator, same with the hip, you have to give a little bit of rotation towards the midline of the body from anterior. Similar to if you were to grab your sleeve in front of your shoulder and pull it towards you as if you were pulling your humerus, you can roll that arm in. That's medial rotation, but you have to pull it from the front. So even though latissimus dorsi may begin in the back, by the time it attaches to the humerus, it is anterior, like the rest of these muscles that help with medial rotation. Lateral rotation or external rotation means we need to pull on that humerus horizontally, if not diagonally, but from posterior. Again, deltoid does this, as do two of the rotator cuff muscles, infraspinatus and teres minor. When you find infraspinatus or teres minor, you would find that they run somewhat horizontally / diagonally, and they attach to the back of the humerus. Really, they attach to the greater tubercle, but from behind. When they cross the joint, they pass from behind. Next, we'll move on to the elbow / forearm. And I include this as one list simply because a muscle that performs flexion at the elbow might also help with supination of the forearm. So, extension, we would need to pull from posterior, right, at the elbow. So that's triceps brachii. That's the posterior arm muscle coming to the back, or the posterior aspect of the elbow. Flexion, there are three of them: brachialis, biceps brachii, and brachioradialis, which actually belongs to the forearm if we were to group it up based upon compartments. But all three of these, the three B's of flexion at the elbow, pull from anterior. So as they cross the elbow joint, they are crossing anteriorly. Then you have supination and pronation. To perform either action, you would need to attach the radius and then pull that radius, ultimately unroll that radius away from the ulna. So biceps brachii would be included, and a muscle referred to as supinator. Then you have pronation, and the muscles that perform pronation would be really to roll that radius towards the ulna, right? Would be the pronator teres and pronator quadratus. And what we mean by that is really at the distal radius, it kind of rolls over the ulna, all right? It rolls around the ulna, but its rotation proximally is kind of rotating towards that ulna. So again, attach the radius and pull toward and around the ulna. And finally, we'll end with the wrist, some muscles of the wrist. And I use some abbreviations here just because the names get a little bit long, but it also helps to kind of see the pattern at a glance, so that might be helpful. So flexion at the wrist, remind yourself, flexion at the wrist, if you are in anatomical position, which we always should be, would be to pull that hand forward, right? Would be to pull that hand forward. So if you're in an anatomical position and your palms face forward, to make that hand pull forward, you can use these muscles, okay? Some of them are actually also going to be the muscles that help you flex the digits or the thumb. So keep that in mind. But flexor carpi radialis, that tells you it flexes the wrist. Carpi means wrist. Flexor carpi ulnaris also tells you it flexes the wrist. What doesn't tell you it flexes the wrist initially would be palmaris longus, but it does cross the anterior wrist on the way to the palm. That's the muscle that maybe not everybody has. But it does cross the anterior wrist in the majority of us that do have one. And then you have flexor digitorum superficialis, FDS. FDP would be flexor digitorum profundus, and then flexor pollicis longus. As these muscles, as their tendons pass anterior to the wrist to the digits, they can help with flexion at the wrist. So keep that in mind. Extension. All of these have extensor as the first name. They all cross the posterior aspect of the wrist. So extensor carpi ulnaris, extensor carpi radialis longus and brevis, ECRL and ECRB. ED would be extensor digitorum, again on the way to the digits. This muscle and its tendon, specifically its tendons, cross the posterior wrist, as do the rest of these. Even though they're named for whatever digit they might be extending, they do cross the back of the wrist on the way to the digit. So extensor digiti minimi, extensor indicis, EI, extensor pollicis longus, EPL, and extensor pollicis brevis. Again, all of these with extensor as the first name will help with extension at the wrist, if not make it their primary job. Adduction, again, you have to remember anatomical position here. If your hands are by your side and your upper limbs are by your side with the palms facing forward, if you were to tilt that hand towards the body, that's adduction. Towards the midline, right? Extensor carpial nares and flexor carpial nares. Keep in mind, we don't have any adductor carpes. So what we use are the muscles that are closest to the medial wrist. And what's the medial bone on the way to the wrist, really the medial bone of the forearm, is the ulna. So you have extensor carpial nares and flexor carpial nares. We do not have an adductor carpi, so what we have to use are the muscles that are most medial in the forearm. You have one in the anterior, that's the flexor carpial nares. You have one in the posterior, that's the extensor carpial nares. Abduction would just be the opposite. You have the extensor carpi radialis, the longus, and the brevis, ECRL and ECRB. And then you have the abductor pollicis longus as well. Again, that's going to abduct the thumb primarily, but it's also really good at abducting the wrist on the way to the thumb, because these are the muscles that are closest to the lateral wrist. They pass lateral to the wrist on the way to their destination.